Now, South Africa's COVID-19 death toll is now sitting at 80,826. According to the Department of Health, 357 more people have succumbed to the coronavirus, while over 12,771 more people were infected with the virus in the last 24 hours. To discuss this further, I'm joined now by Dr. Mvuyisi Mzukwa from the South African Medical Association. He is the vice chairperson there, as well as Professor Theresa Roussow from the Department of Medical Immunology at the University of Pretoria. A very good afternoon to you both. Perhaps let me start with you, Doctor. Looking at these numbers, it looks like COVID-19 is far from over, despite the vaccination interventions. Are you with us, Doctor? All right, while we get the doctor back on the line, Professor, what are your views, just reflecting on these numbers and the rate at which they are escalating, despite the fact that vaccination processes are well underway in the country?
Yes, Tammy, it is very concerning. I think the third wave has lasted much longer and has been much more severe than we anticipated and actually hoped for. So the numbers are not showing any sign of decreasing. At least in Gauteng, things have quietened down, but the other provinces are really taking a lot of strain still.
And let me bring you back here, Dr. Mvuyisi. What is your assessment of the situation? All right, still not having any luck with Dr. Mvuyisi. We'll continue trying nonetheless. But Professor, when we look at these numbers, we see Gauteng, the numbers there are very high. But when we look at places like Limpopo, for example, they are very low, at around 4%, 7%, and that is the number that we're seeing in some of the provinces. Why is this the case, do you believe?
Well, we know that the numbers are probably greatly underreported. Not everybody with symptoms go for testing. Testing is not always available. It is quite expensive in the private sector. So we're probably just seeing the tip of the iceberg. So if we look at the data of the excess deaths that are reported by the South African Medical Research Council, they estimate the mortality to be much higher, probably about 3 times higher than the 80,000 that has been reported. So much more in the line of about 220,000 people who may have died because of COVID-19.
So, Dr. Mzukwa, the professor is of the opinion that the testing is perhaps quite low and there's underreporting. And this is in light of the fact that Limpopo accounted for 2% of the cases, the new cases. The Northwest accounted for 4%. Mpumalanga accounted for 5%. The Northern Cape was 7%. So we're seeing relatively low numbers coming from some of the provinces as opposed to what we're seeing in KwaZulu-Natal, which had 28%, and the Western Cape at 24%. What can we attribute this large disparity of numbers to? I think you may be muted, Doctor. Could you unmute yourself, please? Doctor, are you with us?
Yes, I'm with you. I'm sorry about that. No, I do agree with the professor, on a number of things that she has highlighted. I do think that we are failing in terms of the contact tracing. There's no much contact tracing that is being done, even with the positive cases. So I do think that we need to ramp up on that aspect of our healthcare. But the other thing is that people also are reluctant to test as well. Even people who are symptomatic, they are very reluctant to test. I'm not sure what could be the reason, but it could be related to the restrictions around when you are found to be positive.
So are you then saying that the numbers that we're seeing now may very well be much higher than what is being reported, Doctor?
Yes, I fully agree with you. I have cases where if you find a patient who's positive, you recommend the contacts to be tested. You find that the relatives wouldn't want to be tested, even if they say live in the same house. So that tells me that if those people are not tested are going out there, spreading the virus. And we can see here actually also in KZN, there are so many of the cases, and that could be attributed to the super spreaders. I mean, we've recently seen, a disgraceful party by the MEC, who, had a party during the height of the third wave. It's unbelievable.
Dr. Mzukwa, you'll remember during the looting, so-called looting that we saw in parts of Johannesburg and KwaZulu-Natal, one of the chief concerns during that one particular time is the fact that that was a super spreader event. Have we seen any sort of backlash as far as the numbers of COVID-19 cases are concerned post that particular incident?
Well, it is very possible that we see contributions from there, because remember, it happened haphazardly. There was no social distancing, no mask, nothing, and we know that it will. If you look at the time that it will take from the day you are getting infected up until you develop symptoms, it's a very long time. At times, it could be about 2 weeks apart. So it's very possible that we are getting contributions from those super spreaders as well.
Professor, what has been the efficacy of vaccines that we're using here in South Africa?
Well, Tommy, I think the vaccines are really very effective. We know from multiple clinical trials that they protect against severe disease and death. And that's really what we're hoping for, is to relieve the hospital, to relieve the hospitals from the incredible pressure that they've been working under, and also to prevent deaths in the population. What we don't know, and this is still being studied, and we won't know, until we've been dealing with this virus for much longer, is how effective it is against mild and asymptomatic disease. And that's, of course, important for how the disease is spread in the community. But from the data that we have available, it seems that it protects at least 60% against infection and more than 90 or 95% against hospitalization and death.
And what would you say are the key differences in efficacy between Johnson & Johnson and Pfizer?
Well, they both perform really well, especially against the Delta variant as well. It is slightly less effective against Delta than it is against the original strain, and that is to be expected. But depending on where you look, there are lots of data out there. Some of them come from a lab, and of course the real world is much different. So Pfizer seems to have a slight advantage above J&J. And for that reason, people are thinking about possibly having to introduce a booster shot of the Johnson & Johnson vaccine a little bit later, or possibly even boosting with a different kind of vaccine. It doesn't mean that it's not effective. It just means that we can get it to a greater efficacy if we add a booster shot.
And talking about Pfizer, there's a study that came out of the United Kingdom called the Zoe COVID study. Tell us a little bit about that and what the findings were in that study.
Yes, so they have been tracking the population very closely and looking at the effect of the vaccine in the real population. So what they do see is with the Delta variant taking over, the efficacy is slightly less than we anticipated and hoped for, but it is still in the range of 65 to 70%, so it is still not bad.
So talk us through this. You have your 2 jabs for Pfizer, and it says here that after about 6 months, the efficacy of the vaccine in your body diminishes by up to about 50%, which means then you now have to take another shot 6 months or so after to once again boost your body being able to fight against COVID-19. Could we not find ourselves here in a vicious cycle of always having to get booster shots? Professor.
So, one should understand that immunity is not just the antibody response. So what they looked at is how the antibodies wane over time, and that is expected. We know that the antibodies won't stay at the same level for years to come. What we are looking for is a memory response, and that is quite difficult to study. So there are also studies that have recently looked at lymph nodes of people who've been vaccinated, and they do actually show that people make very good memory responses. So if these memory responses are adequate, then the protection could last up to 2 years. But as I say, in the lab, it's slightly different than in the real world, so we'll have to wait and see. But I definitely think after 6 months, it will not be necessary for a booster yet, even though the antibody levels are lower. If we are going to need boosters, it will probably be more on an annual or even biannual time scale.
Dr. Mzukwa, what has the rate of hospitalization been like? We are understanding that the vaccine is not really there to stop you from contracting the virus, but from preventing you from becoming extremely ill once you have contracted it, if you do. How has this affected the rate of hospital admissions?
Well, I do not have any data at the moment to suggest or to make a comment on that, but what we have noted already is that hospitals are still under pressure. Even in Gauteng, hospitals are still under pressure there. And like you said earlier, it's very important for us to understand that there are so many people who have not yet vaccinated, and there is a great chance of those people populating hospitals, because we know that with the vaccinated, there's less chances of them getting to severe disease and death. So it is very important that we still insist on non-pharmaceutical interventions, not only for the unvaccinated, but the vaccinated themselves, because they can still spread the virus as we know it. So we do need to still emphasize the importance of, avoiding large gatherings and even unnecessary parties and all these things, so that we save not ourselves only, but also our relatives and the loved ones around us, the community at large.
Dr. Mzukwa, thank you very much for your time, as well as Professor Roussow, as we focus on the COVID-19 pandemic. The numbers in South Africa way over 80,000 now, as well as the findings on the latest study on the reduced efficacy of the Pfizer vaccine, specifically after 2 jabs after a period of 6 months. This was Dr. Mvuyisi Mzukwa. He is from the South African Medical Association.